Hello class, welcome back. So this next whiteboard is about a topic that I get asked a lot from both patients and students. It's about injury and specifically the wound healing model from the point of some injury to a body. Let's say you get a cut, you get bleeding, platelets come to the area, collagen forms and then remodels. You get this whole cascade of events that take place, and inflammation is really forming the base of that, which is what we talk about when we do things like PRP injection and in general when people heal from injuries. So I decided to do a little whiteboard that ended up getting very messy, and it's hard to do, but the whole point of this is so you can then do it yourself and practice and do it better than my messy handwriting.
Okay, so today we're going to review the 3 phases of wound healing. Now, the skin is the model that we use typically, but this applies whether it's muscle, tendon, ligament, or even to a certain degree, bone. Now, in general, there are 3 phases: inflammation, followed by the proliferative phase, where there's granulation tissue forming, and then finally, moving on to the remodeling phase or maturation. Some people feel that in the initial stage leading to inflammation, we should consider hematoma or hemorrhage or hemostasis initially occurring that leads to the actual inflammatory phase. So some people say, well, there should actually be 4 stages, with the hematoma forming the initial phase, since that's where the all-important platelets come into play. Now, in sports medicine, platelets have become quite the hot topic, and specifically PRP, platelet-rich plasma, since we are mimicking this initial hematoma and hemostasis phase with platelets accumulating, which secrete all their growth factors that lead to inflammation that finally leads to wound healing, and in this case, for example, tendon healing, better healing from a tendon tear, since you are kind of kickstarting and supercharging this initial phase that leads to a better, finally, ultimate remodeling phase. Now, you've probably seen this type of slide before, where we initially have the inflammatory phase, which then gets followed by a proliferation phase. So here we have inflammation, here we have proliferation, and there's a lot of granulation tissue forming in that second phase. And then the third phase, which you may have seen drawn different ways, is the remodeling phase. Now, the timing is what makes the difference here. Some people say the first 3 days are inflammation, but other people say, specifically for skin, that can actually be about 6 to 7 days. So there's a little bit of variability there, but a lot of us use in sports medicine that 72 hours or 3-day phase, marking this initial inflammation phase. The second phase of proliferation can actually start as early as about day 1, right there. And then there's a little bit of an overlap from inflammation to the proliferation phase. And that can continue out again, depending on who you talk to and what graph you refer to. Some people say this is as early as 10 days. A lot of people say it's about 21, even to 25 days. So 3 weeks is commonly used. So if you have the 3 days and then 3 weeks, you should usually get most answers right when you're reviewing this for inflammation and then proliferation. And then lastly, we have the collagen accumulation, remodeling, maturation phase, where all that collagen that starts forming starts to mature. And this, again, has differences that's out in the literature depending on what we are talking about. So in the skin model, collagen starts forming even as early as 3 days, way out here, but is very weak, and then starts to kind of peak maybe at about 10 to 14 days right there, and that's often when stitches come out in a wound healing model. But then it continues for a long time until it finally finishes and your body is considered recovered. Again, wide variability in this remodeling or maturation phase here. Some people say it can last up to 100 days, which is your 3 months. So we have 3 days, 3 weeks, 3 months, and that'll take care of most answers in a textbook here. So 3 days, 3 weeks, 3 months will get you pretty far. But it can take up to 2 years to remodel. And the other graph that is often included in some slides, but not in others, is the overall strength of that wound and the contraction. And that starts, in about 3 days when it's initially forming, but the strength of that tissue can take a while to heal. So even at 14 days when, for example, stitches come out, which is another landmark time, your wound is not necessarily at its 100% max that it's going to be at when it initially forms from 0 to 100. It takes a long time for that to finally grow out and mature and be strong again, which can be as late as 100 days, 3 months, which is why we do not want to return an athlete too early to sport, right when a stitch comes out or right when a brace comes off, for example. That might be potentially at that 21-day mark. 3 weeks later, the athlete goes back to sport. Their wound or their injury is not fully at 100% yet, so we have to make sure that they are truly ready to return. Now, if we were to take this cascade and draw it in a different way, we paint a nice picture on what's going on at the wound level in terms of all the different players. So we're going to start with an injury, which we're going to write in red since that hurts to get injured. And then what happened is two things actually get released. Some books mainly focus on the platelets, but complement also is in play here. Along complement, kinins get released like bradykinin, and that also contributes to what happens here is, put that in yellow, inflammation. These are going to be things like prostaglandins. Bradykinin is one of the kinins that we talk about. Leukotrienes are also involved to a certain degree. And the prostaglandins and bradykinins especially certainly contribute to pain, right? It hurts so much. Now, there's not only inflammation that occurs in this situation, platelets also do other neat stuff here. So platelets, I'll draw this over here, take two routes. They stimulate the beginnings of proliferation in the world of fibroblasts. They also tell endothelial cells, which are the cells that line the vessels, the blood vessels, to grow some more blood vessels, get some more blood flow into that wound so we start to recover. So there's blood vessel growth as well. Now let's get back into inflammation here. Go back to our yellow or orangish color. Macrophages come into play here, as well as some lymphocytes and neutrophils here, polymorphonuclear cells. They are going to do what? They're going to start chewing away and eating away. I guess I'll make that black again, since that represents debridement of dead cells and necrosis. It's just going to eat away and chew away and phagocytose all those areas, which is going to lead to breakdown of collagen lysis specifically. On a side note, these cells also, and we'll make this green, all your white blood cells contribute to resistance to infection. Right? You have a wound, you have an injury, you don't want it to get infected, and these cells contribute to that. A little side note there. Now, on to the collagen. We still haven't talked too much about the right side of the screen here. What's going on with fibroblasts? Well, they're going to do a couple other things here, and even the angiogenesis to a certain extent. They are going to tell the body, well, we need more new healthy collagen, so we have collagen synthesis of new skin or tendon or ligament, whatever the case may be. And then you get this nice balance here in terms of a there it goes, pen didn't write there, cycle between collagen lysis and collagen synthesis. And this is what's happening in the remodeling phase there, where your body is deciding, okay, I don't need collagen in this area, and this collagen is all damaged anyway from the injury, and then I'm going to balance that with new healthy collagen synthesis on this side of the equation, stimulated by fibroblasts in the endothelial cells. So we have the initial injury phase, which I guess I'll put in blue here, right there, phase 1. That leads to this inflammatory phase, which is going to be phase 2. And then over here in the remodeling phase is phase 3. Now there's another arm of this pathway here that fibroblasts also get involved in. Bring it down here, and then I'll turn this way, is the contraction of the wound. And as the collagen gets laid down, your body continues to tighten things up and then align things in parallel. So the collagen fibers are lined up nicely. That is also part of phase 3 right here. So this is a nice alternate way in terms of a graphic representation of what's going on from phase 1, 2 to 3. We're not done yet. Another way to draw this is at the cellular level. So let's start with injury. So we have a layer of skin. We have said injury to that skin where we get destruction of tissue. There is also destruction and damage to the blood vessels underneath. That's about as best as I can draw. Blood vessel, sorry. And one of the first players to the scene that gets released here are platelets. Complement is also involved. We're just going to draw that as a C. And what happens? Well, if I draw the blood vessel now here, you're going to get a lot of permeability and, so to speak, holes in the endothelial cell layer that allows things like platelets and complement to seep out into the skin, underneath the skin in the subcutaneous tissue layer and the tendon layer where the injury is, or ligament layer, what have you. It's going to allow for edema and swelling in that area. Initially, you'll actually have the blood itself, draw that as a little bit bigger arrow, bleeding into this area, and you'll actually get hematoma, and that is that initial pre-phase 1 stage, which we can, I guess, sort of draw as a pre-phase 1 stage. But the actual phase 1 stage here, the edema and inflammation, is occurring right here. This is where there are some other players that come in along with platelets and complement. We have the neutrophils, polymorphonuclear cells. We have macrophages. They all leak in to this area, and I'll kind of redraw it as a bigger box right here. Right, we have our neutrophils, we have our macrophages, we have our platelets, we have our complement. There are a couple other players involved here, mast cells, which are locally present in the tissue, get stimulated from that injury right there. They're just hanging out, and then they release all their molecules, things like histamine. So I'll start writing this stuff in. Histamine. We have our kinins, our bradykinin being a major one. Other things that get released here, we have prostaglandins, we have leukotrienes, and there are a couple other cells that release certain molecules like TNF, alpha, IL-1, that's not drawn right, IL-6 and IL-8. These are all the cytokines and growth factors that stimulate initially inflammation, but then that actually leads to the next phase here, moving down. So here we have proliferation, part 2. All these molecules now tell the local fibroblasts that are in the region saying, hey, we need some more collagen and we need it now. So in this next phase here, fibroblasts are going to produce more collagen, right? While macrophages are going to eat up the collagen that is not needed, and we have that nice cycle here of collagen synthesis and collagen lysis to produce nice, healthy, new collagen, and that is going to be, right, phase 3. So here's another way you can draw it out, and there you go.